Hello everybody, my name is Emery and welcome to my basic phlebotomy podcast. Today we're going to be talking about the limitations and precautions you should think about when drawing blood from your patient's hands. I'm trying to get across crucial factors to make sure your patient can have the best trip while we are still delivering effective care. Nobody wants to go and get traumatized by the doctor. So let's get into some of the limitations. Hand veins are pretty small and shallow, and they're often fragile too. This combination makes it very easy to poke either straight through it or right next to it. So you got to be very careful when messing with the hand. They also roll a ton. You might not even be able to see them. There's a lot of factors that go into visibility, such as patient hygiene, age, and even their mood coming into the visit can affect. Some conditions like anemia or obesity can just make things harder for you. Alright, now let's talk about some important precautions. First, you got the injection site. Choosing the right one is crucial. It's important to choose a vein that's accessible and it doesn't look like it might collapse on you. I don't even want to imagine what a collapsed vein might feel like. That would be horrible. Clear communication with your patient is essential too. They should always know what's going on and what to expect going forward. You never keep your patient in the dark. Lastly, you have to stay after the procedure to monitor him, make sure he doesn't have any complications like hematoma or prolonged bleeding. That can happen if you take the tourniquet on or off after you pull out the needle. Alright, in summary, while drawing blood from the hands is a common procedure, it's important to consider your limitations and to take the necessary precautions to ensure patient safety. I've never personally stuck anybody, but I've practiced on mannequins in class before. And from what I've seen, it's not too hard. As long as you follow the right steps and do it in a safe and careful manner, you'll be okay. There is a lot of room for error though, so you have to be very cohesive and coordinated with it. Personally, I think drawing blood from the hand sucks. It hurts and you're like right in the patient's face a little bit. But, if there's complications with that patient's veins or the procedure just calls for it, sometimes you have to do what you have to do. Thank everybody for listening. I hope this information was helpful. I'm by no means a professional, but if you found it helpful, share it with your peers. And a big shout out to Miss Standerford.